I'm Mark Harrington from the Treatment Action Group, and this is the 2009 TAG report on research funding trends in tuberculosis research from the year 2005 to 2008. For just the cost of 500 soldiers in Afghanistan, we could double the amount of spending on TB research. Now, why is this important? We have new drugs, we have new vaccines, and we have new diagnostic tests all in the pipeline that are ready to be tested. But we don't have research systems in place to test them. So TAG, and this year for the first time the Stop TB Partnership partnered with us, are calling on donors and world governments to not just double, but to quadruple their spending on TB research so that we can accelerate the development of new tools. One example is if you double the size of a trial of a new drug, you could get it approved 2 years earlier. That's really concrete, and that means that we could get MDR TB control under control 2 years earlier if we had the 2 new drugs approved 2 years faster. The biggest roadblock to getting people onto effective treatment is the lack of a point-of-care diagnostic test that can be used wherever the patient is. We don't know what target to have, so we're sort of pre-1985. We're still, in fact, we're in 1882 because that's the year that the microscope was discovered to diagnose TB by Robert Koch. So diagnosis is number one. Number two is the infrastructure to do the phase 3 trials for vaccines and drugs. And the reason why I put it together is because you need the same kind of sites to do both. You need places where there's a lot of TB. This means research will happen where the TB problem is the worst. And we think that it's good that the research be done there. But we just heard from Dr. Chakaya from Kenya that countries in high-burden countries don't put any money into their own research. So the third ask is really for high-burden countries to step up to the plate and start investing some of their own people and manpower and young people into science to cure the disease. I've been going to these union meetings since 2002 when there was just a small handful of activists that were working on TB and TB-HIV co-infection particularly. And what I've seen since then is that there's been a real expansion in the amount of community involvement and community pressure and community activism in the TB world. We're bringing energy from the HIV activist world into the TB world, and so that's one positive change.